The American healthcare nightmare has come to India. For decades, Indians looked at the American healthcare system with a mix of disbelief and dread. Ambulance rides that bankrupt families, insurance companies deciding who lives, who waits, and who pays. We told ourselves that won't happen here. Healthcare in India is different. Doctors are trusted, you know them and their families. Costs are lower and no hidden charges. Compassion still matters. That illusion is cracking and really fast. Want to know why? This is Quick Take, your quick guide. I'm Smita Prakash. The American healthcare nightmare has arrived in India, stealthily and systematically, profitably to those who invested in it a few years ago, and we users who marveled at facilities available for a price now are cogs in the wheel. Let's start with insurance. When you buy health insurance today, you assume it protects your family. In reality, many policies come with invisible strings. Insurance firms now increasingly dictate lines of treatment, not medically but financially, and hence, yes, medically. Doctors are nudged, sometimes openly, sometimes subtly, to prescribe what the insurer will reimburse. Not what is best, not what is simplest, but what fits the billing code. Like, for example, you have a large insurance policy. The suggestion will be to use the most expensive stent for your heart surgery, when a cheaper one might be just as good. The question is no longer what does the patient need, it is what will the insurer approve. It is a one-day stay in the hospital. Do you really need a suite? But insurance is fat. So the hospital says to you, there are no private rooms. The general ward, yes, or a suite. The thought of a general ward is not so nice, so you pick a suite. That's 10,000 rupees a day, when you could have got a private room for 2,000 rupees, but the man behind the desk said not available. The morality is ambiguous. Most hospital managements try to tell themselves that they are not really cheating a patient, a human. They tell their staff insurance companies are paying, it's not going from the patient's pocket. Yes, it is. Doctors across private hospitals are under pressure to tailor treatment plans based on how much the patient can pay or how deep the insurance coverage runs. Two patients, same condition, two entirely different treatment pathways. One gets observation, the other gets intervention, sometimes a surgery. And that brings us to the most disturbing trend: unnecessary procedures. Many hospitals today are not just places of healing, some are revenue machines. Patients are increasingly pushed towards surgeries that may not be immediately required because surgeries, ICU, and extended stay mean huge billing pay. Fear becomes a sales tactic and urgency becomes a leverage. It's done in a subtle manner where it appears that you have options, but actually you have little wriggle room. When a family is told, operate now or risk complications, you brought your mom at the right time, a few hours late, and it would have been too late. We are wheeling her into the ICU. You can make the payment now and we'll call in the surgery team. Who can argue? You just believe the medical team because you trust the system and the doctor. And they just might be right. But what happens when that system itself is compromised? Many large hospitals are now owned or heavily influenced by profit-driven investors, private equity, venture capitalists, corporate boards with revenue targets. Healthcare, once seen as a social service, is now a high-growth sector, a business vertical, a balance sheet opportunity. And businesses don't measure success in recovered patients. They measure it in margins. This is the American model that we feared. It's here now. The efficiency, slickness, and cost and profit and loss. Doctors are service providers. Patients are customers. Illness has to be cured, yes, but it's an opportunity to profit from. None of this is to demonize doctors. Many are resisting this pressure. Many are deeply uncomfortable. But the system around them is changing faster than ethics can keep up. If healthcare becomes purely transactional, trust collapses. And when trust collapses, medicine stops being healing it heads to becoming exploitation. India is at crossroads. We can still choose regulation over predatory practice, patient interest over profit obsession. But if we don't act, if we keep pretending this isn't happening, then one day we'll wake up and realize something essential is gone: faith. And once healthcare loses its moral core, no insurance policy can save us.